Good afternoon, everyone. Today, I will be sharing insights from an interview with a counselling professional. We have interviewed ENCIK Abdurrahman Ashraf bin HAIRONANUAR, a counselling officer at the Department of Psychiatry and Mental Health from Hospital Sultanah Bahiyah, Kedah. ENCIK Abdurrahman graduated with a bachelor's degree in counselling from the University of Malaya in 2020. He began his career at UiTM Tapak. Then he worked in the private sector for 3 years before joining this hospital, where he has served for the past 2 years. His professional registration numbers are KB09330 and PA08949. His areas of specialization include working with palliative patients, providing psychological first aid for disaster victims, and also healing hysteria cases at school. Currently, ENCIK Abdurrahman holds the position of psychology officer, and his daily job scope is primarily focused on individual counselling. He works with patients that are diagnosed with a wide range of mental health conditions such as bipolar, anxiety, schizophrenia, PTSD, autism, and ADHD. For individual sessions, he uses the HERO module to support patients recovering from drug addiction and to prevent relapse. He also conducts group counselling about once a month. These sessions are specifically for palliative patients and their family caregivers to provide emotional stability and peace during the end of their life process for both the patient and their loved ones. Regarding the workload, the counselling officer handles approximately 11 cases per day, totaling about 55 cases per week. This high volume means sessions have been shortened from the earlier 16 minutes to 45 minutes per session. He described this workload as somewhat unrealistic but still manageable. In terms of remuneration, he stated that his salary is sufficient for his living expenses, and as a government employee, he benefits from an annual salary increment which provides some financial stability. In terms of career progression, within the government sector, confirmed officers are eligible to become head of unit with the rank of D41 as a supervisory role. When asked what he finds most satisfying about his work, ENCIK Abdurrahman shared that the greatest reward is seeing his patients recover and live a better life. He gave an example of a patient who once felt unable to continue living but after treatment was able to return to work. These transformations are what keep him motivated and committed to the counselling profession. The counselling officer described his workplace environment as good, with colleagues who are easy to collaborate with and supportive. However, the main challenges he faces are client-related. These included cases of PICA, where patients ate non-food items, and poor commitment to treatment. Some patients refuse to attend sessions or to take their medication, which can lead to dangerous consequences. For instance, he shared a case of a male patient, due to non-compliance, stabbed his girlfriend next with a pen. This highlights the serious risks that can rise when patients do not follow their treatment plans. To ensure his personal growth, ENCIK Abdurrahman is proactive in attending courses beyond mandatory training, including courses on palliative care from a spiritual perspective and trauma treatment. He also shared one of his most challenging cases. It involved a family with severe trauma, where a mother with 3 daughters from a previous marriage who remarried, and their stepfather raped the eldest daughter twice, resulting in 2 pregnancies, and also assaulted the younger sisters. He even sold 1 child in Thailand. The mother, to support the family, compromised her own dignity with a government official. This case illustrates the extreme trauma that counselors can encounter in their work. In terms of organizational support, the hospital provides medical assistants who are present during sessions as backup, especially in case a patient becomes aggressive or an emergency occurs. For this theoretical approach, ENCIK Abdurrahman prefers cognitive behavioral therapy, CBT, because it is easy to apply and easy for patients to understand. Finally, he uses specific techniques like art therapy, which is especially helpful for children and patients who refuse to speak. And also he uses scaling questions, which he uses before and after sessions to measure progress and improvement. Thank you, that's all from me.